Good morning. I'm going to talk about what the symptoms are of flu. One hopes everybody got their flu shot, an imperfect vaccine, but can be very helpful and especially save lives of elderly people when the young get vaccinated. If you look at this video, also seek the advice of your pediatrician as well. Typical symptoms of flu are fever, headache, body ache, and sore throat. Now most parents, and the fevers can be high, 104 for up to 5 days. Many parents, when they hear their child has a sore throat, feel that, oh, they must have strep. But people with strep, it's rare to have a cough, and so when you swallow, it doesn't hurt, even though they complain of their throat hurting, probably just from the coughing. So keep in mind, your child will look pretty sick with it, pretty wiped out. As long as they're drinking and you feel the antipyretic fever control is working, Tylenol, ibuprofen, then accept that they'll have a 5 to even up to 7 days of fever. Now, if it goes beyond that point, we have to be concerned about pneumonia, and we have to be concerned about sinuses as well. And that's when we really need to see them. And occasionally, it'll happen earlier in that, and you'll have a gut sense if your child's getting sicker and sicker. And especially with people that have a high risk, like asthmatics, or immune-compromised kids, or kids that are neurologically impaired. These are the ones that we oftentimes would like to see earlier. But remember, the key is headache, body ache, sore throat, and fever. And when parents come in, they're thinking of pneumonia, and they're thinking of strep throat. When it turns out, in fact, because of the cough and the body aches, this generally points towards flu during the flu season. Oftentimes, flu goes from December to May at this point. So feel free to call us if you think about treatment, but if you have a child with no risk factors who is a normal, healthy child, and there's no one in the household who's at high risk for complications of flu, then we sit tight. We don't think it's necessary to treat every child, despite what you hear on commercials these days. Also, kids under 2, we like to hear about as well. So these are the issues with the flu. So expect if your child gets this, it'll take about 5 days with fever, headache, body aches, and cough. This is Lester Hartman at Westwood-Mansfield Pediatrics. Have a nice day.